New at 6 and only on KDKA. At this very moment, about 700 people across Pennsylvania rely on a ventilator to breathe. And with only 24 facilities statewide that specialize in caring for them, patients must move at times hundreds of miles away from their home to receive that care. Now, a severe lack of funding is straining those same facilities that are keeping these people alive.
KDKA investigator Meghan Schiller takes a look at why the money is drying up and the new well some are trying to tap.
With ventilator tubing hugging her throat and a canister of oxygen by her side, Lori Plazik spends her days in this bed.
It's different. It's just hard to get used to.
The ventilator breathes for her 24 hours a day. Her life took a tragic turn 19 years ago.
I swear to miss a deer and hit a tree.
Now paralyzed from the chest down, she receives around-the-clock specialized attention here at Transitions Healthcare in Washington, PA.
There's different aides doing different shifts. They come in and help me. And there's other people that come in and help.
She's unbelievably upbeat. But when asked what upsets her the most, Lori says her family lives 2 hours away.
Yeah, they can only go once a week to visit me.
And there's no facility near your house?
There's a couple, but they've been trying, but they're full.
Lori can't spend her days surrounded by her children because the number of open facilities keeps shrinking. The wait lists to get a vent bed keep growing. Of the 627 nursing homes across the state of PA, only 24 provide ventilator care. One facility near Philadelphia just closed a 30-bed ventilator unit. Another shut down its 23-bed unit this fall, and another issued a self-imposed quota to cut costs, dropping the available open beds from 75 to 50. 4 more facilities just filed for Chapter 11 bankruptcy, unable to pay the bills for one reason.
The average reimbursement right now is about $259 a day, and the average ventilator cost is $700.
That means for one vent patient, there's a gap of $441 in coverage. Multiply that by all 16 patients nestled along this hallway, and Transitions Healthcare needs to absorb a loss of $7,056 per day. For 1 year, they're in the red more than $2.5 million.
This is where the senator's bill is so important. We need a supplement to help us afford the cost of care. And everyday suppliers are increasing our costs of care, and the CHC program hasn't made adjustments for that.
Administrator Jennifer Watson said the daily cost for the care of a vent patient is almost 3 times the amount of the negotiated Medicaid subsidy. So where does the needed money come from? She's relying on State Senator Camera Bartolotta to help.
I just hope that people understand that this is an issue in their own neighborhood, in many of their neighborhoods, and we're losing facilities like dominoes, and this bill can stop that domino effect.
Bartolotta co-sponsored Senate Bill 959. It would send an extra $130 a day per patient to each of the facilities still hanging on.
These institutions for 3 years now have been waiting to have their Medicaid reimbursement increased. They're not asking for the sun, the stars, and the moon. They're asking for a small increase just to keep the doors open.
The bill is bipartisan and would appear as a line item on the state's new budget. She hopes to soon move it out of committee and onto the Senate floor. Watson reminds her time is running out. The first wave hit Philadelphia this past fall, and Pittsburgh will be next.
I think people don't think about this issue because they never suspect it will be them, but every single person is one diagnosis, one slip on the ice, or one car accident away from being one of our patients.
And for those patients tethered to the ventilator,
If they're not getting help, it's they're either gonna die or find someplace far away that their family can't go to be with them.
Now, Watson said it's been this way for 3 years. And if you did the math, you've realized by now that the state senator's supplement still is not enough money. But these facilities have already exhausted all their savings, so they say they're going to take anything that they can at this point. They're grateful for anything.
You mentioned the word nursing home, and we think of that. We think of mainly the elderly there, but that's not necessarily the case on these ventilators.
Right, I was surprised when we walked through the halls and saw the patients that are there on the ventilator. The average patient there at this facility in Washington, PA is just 53 years old. Wow. And as you heard her say, really, this can happen to anyone. And these people, you can't just take the ventilator off and go home. So this is a life-sustaining thing to keep them alive. So they really hope that Senator Bartolotto's bill gets into this budget and that they can at least get some help.
All right, keep us posted.
Will do.
All right, thanks, Meghan.
Thank you.